Hi everyone, I'm Dr. Kat Karami. I'm the medical director of Allurant Medical, and today I want to talk about shockwave therapy. Alma Duo Shockwave Therapy is the brand that we're carrying. In general, shockwave therapy is treatment for multiple things. In this clinic, we primarily use it for intimate wellness. Initially, it just sounds really scary because of shock, and everyone thinks they're going to be shocked. In fact, it has very little sensation. At most, it has like a tapping sensation on the area where we're using it. It has no pain, no downtime, and a very easy to tolerate 12 minutes a session. Now, what is this for? Shockwave therapy delivers shockwaves, low intensity shockwaves that are acoustic, and it's delivered to the tissue to create increased blood flow, increase health of the tissue, and therefore increase in the sensation. We're using it in intimate wellness. So that means that we're applying the shock waves to the sexual organs. In the case of the men, it's applied to the male penis and sometimes to the prostate for prostate health. For women, it's an external application on the clitoris and the wings of the clitoris on the labia. Now, why do we do this? For men, it's to optimize the erectile function. So that means that ability to gain firmer erections, harder to maintain it for longer, and possibly a change in size, although that is really not the purpose or the promise of any of the treatments that we do for intimate health, but it is a possible side effect. We apply this twice a week for 3 weeks. And so it's a total of 6 sessions. Take a pause and repeat that in a couple months if needed. So it takes about 6 to 12 weeks to have the maximum effect from this. How it works, the shock wave goes and disrupts the lining of the blood vessels to the organ, and that starts a whole cascade of changes in the body that naturally create more vasculature. That means the tree of the blood vessels becomes fuller. Now, for women, we're pretty much identical in anatomy, just different sizes. So the clitoris is an equivalent of the penile tissue, and the shockwave therapy for women is to optimize orgasmic function, the ability to climax by engorgement. So same thing goes, the tissue will have more blood flow and more sensation, which helps with the climax as well. And if we hit target after 6 sessions, then we can repeat it in a year. Or alternately, I tell people just have a maintenance program, get the optimization after 6 sessions, and then 1 treatment every 2 months. Incredibly effective, hard to believe. Really, the hardest thing is for people to experience it and think, are you doing anything? Because it doesn't hurt, it doesn't zap, there's no numbing needed, no downtime. It's incredibly effective. It's one of the best treatments because I don't even have to convince people they should go through numbing or needles. So if you think you're interested to find out more about this treatment, give us a call, drop us an email, and I'm happy to see anybody in consultation.